Hello and welcome to our channel. I am your AI host, generated by Etesham. We strive to provide you with clear, comprehensive and engaging content on a variety of health topics. Today, we're turning our focus to a critical and prevalent health issue, chronic obstructive pulmonary disease, or COPD. This condition is common, yet often misunderstood, and we're here to shed some light on it. So, sit back, relax, and let's dive into the world of COPD together. Do you know what chronic obstructive pulmonary disease is and how it affects your body? Today we're going to delve into this common, yet often misunderstood, medical condition. As we venture into the world of chronic obstructive pulmonary disease, it's crucial to understand the pathological changes that occur in the lungs due to this condition. COPD is not just a single disease, but a collection of conditions that obstruct airflow and cause breathing problems. The first manifestation of COPD is the destruction of the walls between the air sacs in your lungs, a condition known as emphysema. This leads to fewer and larger air sacs instead of many tiny ones, reducing the amount of oxygen that reaches your bloodstream. The second significant change is the thickening and inflammation of the airway walls, a condition known as chronic bronchitis. This results in excessive mucus production, causing a persistent, often productive cough. These changes, and others associated with COPD, progressively limit the flow of air into and out of your lungs, making breathing a challenging task. In the next scene, we will delve deeper into what exactly COPD is and how it affects your daily life. In this scene, let's take a closer look at the clinical features of chronic obstructive pulmonary disease, or COPD. As we've already discussed, COPD is a group of progressive lung diseases that cause increasing breathlessness. But this breathlessness is not the only symptom. COPD patients often experience a persistent cough, sometimes with mucus. This is a direct result of the thickening and inflammation of the airway walls we talked about earlier. Another common symptom is wheezing, a whistling sound when you breathe, caused by the narrowing and obstruction of your airways. As the disease progresses, you might notice a lack of energy or unintended weight loss. These are systemic symptoms that reflect how COPD affects not just your lungs, but your entire body. Physically, a person with advanced COPD might develop a barrel chest, a rounded, bulging chest, because of the trapped air in the lungs. You might also notice them using a technique called pursed lip breathing to help manage their breathlessness. This involves breathing in through the nose and exhaling slowly through pursed lips, which helps to keep the airways open longer. Understanding these clinical features can help in early detection and management of COPD. In the next scene, we will delve into what exactly COPD is and how it affects your daily life. In this segment, we will delve into the various investigations used to diagnose and monitor chronic obstructive pulmonary disease, or COPD. If you or someone you know is experiencing the symptoms we've discussed, it's vital to seek medical help to confirm the diagnosis and start suitable treatment. The first investigation is usually a spirometry test, a type of pulmonary function test. It measures how much air you can breathe in and out and how quickly you can do so. This helps to assess the severity of any obstruction in your airways. Next, we have chest X-rays. While not as sensitive as other tests, they can help rule out other conditions that might cause similar symptoms, such as pneumonia or lung cancer. In advanced stages of COPD, certain characteristic changes may be visible on an X-ray. Then there are blood tests. These are useful to rule out other conditions and to evaluate your overall health status. One such test is the arterial blood gas test, which measures the levels of oxygen and carbon dioxide in your blood. In severe COPD, oxygen levels may be low and carbon dioxide levels may be high. Lastly, a CT scan may be done in certain cases. This can provide a more detailed image of your lungs, helping to detect emphysema, one of the conditions under the COPD umbrella, and to determine if you might benefit from surgery for COPD. Remember, early detection and management can significantly improve the quality of life for people with COPD. In the next scene, we will dive deeper into what exactly COPD is and how it affects your daily life. In this part of our discussion, we're going to talk about the prognosis of chronic obstructive pulmonary disease, or COPD. Prognosis refers to the likely course and outcome of a disease. It's important to remember that COPD is a progressive condition, meaning it generally worsens over time. However, the rate at which COPD progresses can vary greatly from person to person and is influenced by several factors. Firstly, the severity of the disease at the time of diagnosis plays a significant role. Those diagnosed at an earlier stage where the lung damage is less severe generally have a better prognosis than those diagnosed at a later stage. Secondly, the patient's age and overall health also matter. Older individuals and those with other serious health conditions such as heart disease or diabetes may have a poorer prognosis. Thirdly, the patient's response to treatment can significantly impact the course of the disease. Those who respond well to treatment follow their treatment plan strictly and make necessary lifestyle changes, such as quitting smoking and maintaining an active lifestyle, often have a better prognosis. Lastly, the presence of complications such as frequent exacerbations, respiratory infections, or the development of respiratory failure can also worsen the prognosis. Remember, while COPD is a serious and progressive disease, the right treatment and lifestyle changes can significantly slow its progression and improve the quality of life. In the next scene, we will dive deeper into what exactly COPD is and how it affects your daily life. In this segment, we will be discussing the various treatment options available for chronic obstructive pulmonary disease, or COPD. The primary goal of COPD treatment is to slow the progression of the disease, relieve symptoms, and improve your overall health and ability to function. The first line of treatment typically includes medication. Bronchodilators are often prescribed to relax the muscles around the airways, making breathing easier. Inhaled corticosteroids can help reduce inflammation in the lungs, and antibiotics may be used to treat or prevent lung infections. Another important part of COPD treatment is pulmonary rehabilitation. This is a program that combines education, exercise training, nutrition advice, and counseling. It's designed to help you stay active and carry out your daily activities. For those with severe symptoms or low oxygen levels, oxygen therapy may be recommended. This involves breathing in oxygen from a machine or tank at home. In very severe cases, when all other treatment options have failed, surgery may be considered. This could involve a lung transplant or a procedure to remove damaged lung tissue. Remember, COPD affects everyone differently, and what works best for one person might not work as well for another. It's crucial to work closely with your healthcare provider to develop a treatment plan that suits your needs and improves your quality of life. In the next scene, we will go more in depth about what COPD is and how it impacts daily life. Chronic obstructive pulmonary disease, or COPD, is a term that describes progressive lung diseases including emphysema, chronic bronchitis, and refractory, non-reversible asthma. This disease is characterized by increasing breathlessness. It's like trying to breathe through a narrow straw, if you can imagine that. But what causes this breathlessness? It's primarily caused by long-term exposure to irritating gases or particulate matter, most often from cigarette smoke. People with COPD are at an increased risk of developing heart disease, lung cancer, and a variety of other conditions. Now, let's move on to the symptoms. COPD makes it harder to breathe. Symptoms often don't appear until significant lung damage has occurred, and they usually worsen over time. Common symptoms include shortness of breath, especially during physical activities, wheezing, chest tightness, having to clear your throat first thing in the morning due to excess mucus in your lungs, a chronic cough, and frequent respiratory infections. You may also experience fatigue, unintended weight loss, and swelling in ankles, legs, or feet. If you experience any of these symptoms, it's important to seek medical attention immediately. Now let's talk about exacerbations, which are periods when symptoms become worse than usual. These can be triggered by infections or exposure to certain environmental factors. During an exacerbation, you may need additional medications and hospitalization. In some cases, COPD may lead to type 2 respiratory failure. This is when there is a decrease in the level of oxygen in your blood, combined with an increase in the level of carbon dioxide. This can lead to confusion, unconsciousness, and if left untreated, can be fatal. Another complication of COPD is cor pulmonale, a condition that causes the right side of your heart to fail. This happens when your heart has to pump harder than normal to move blood through damaged lungs, which can weaken your heart over time. In summary, chronic obstructive pulmonary disease is a progressive lung disease that is primarily caused by long-term exposure to irritating gases or particulate matter. Symptoms often include shortness of breath, chest tightness, and frequent respiratory infections. Severe complications can include exacerbations, type 2 respiratory failure, and cor pulmonale. Understanding COPD is essential not just for those who are affected, but for everyone. The more we know, the better we can protect and take care of our lungs. Remember, your lungs are vital for your overall well-being, so let's make sure to keep them healthy and functioning at their best.